Now I have Dr. Malisa Ami, the resident consultant ophthalmologist at Sunway Specialist Center Damansara. Sunway Specialist Center Damansara now provide drive-through screening for the COVID-19 test. We would like to know your opinion whether people should be coming forward to have this test or not, and what is the impact of doing this screening to flatten the curve.
For COVID-19, if one person is infected with the virus, they can infect a further 2 to 3 other persons. And each of these 2 to 3 individuals can further infect another 2 to 3 persons. So as you can see that the effect amplifies, and then you can get, if it goes unchecked, then you can get an exponential rise of the number of cases. To flatten the curve, there are 2 things that we have to do. One, we have to isolate the infected cases from the non-infected cases, as what we term as breaking the chain. Secondly, it is up to the public, up to you and me, to prevent ourselves from getting infected. And how do we do this? We do this by staying at home, by social distancing,
like what we are doing now.
by social distancing if we need to go out, and to continue practicing strict personal hygiene, washing our hands and preventing touching our eyes, face and nose whenever we think, whenever we think that we could have been exposed or the hands can be contaminated. I'm happy to see that Sunway Specialist Center Damansara has taken up the challenge to combat COVID-19 by providing a drive-through testing which is convenient and affordable. So those who are worried that they might be exposed, also those who have, they have a bit of a sore throat and a bit of snuffly nose, and you are worried that you might get or you might have COVID-19, then this is a facility that can cater for that. I would also like to highlight that Sunway Specialist Center Damansara's usual facility of the specialist clinics are running as usual. Our regular patients can be reassured that the drive-through testing is held outside of the clinic, and the teams handling the COVID testing is sourced externally, and they're separate from our internal staff who runs our usual normal specialist clinics.
And they are fully equipped with the PPE, right, doctor?
Yes, and those who are outside, follows the standards and the requirements of Ministry of Health with full protective equipment.
I'm a gynecologist and fertility specialist at Sunway Specialist Center Damansara. So as you know, COVID-19 is very infectious and we all should be staying home to stay safe. But there are times where you do need to come and see your doctor. So I do urge that if you are feeling unwell, if you, for example, have a very heavy period and you need to come and see your gynecologist, then you should still come to see us. If you have a routine follow-up and you're unsure as to whether or not to come and see us, please feel free to call our hotline to see if you need to see us. If this appointment is not an emergency appointment, you can seek medical advice to see if you can come and see us later. For all pregnant ladies, please do not default any of your follow-ups because each and every follow-up is important for your health. Every staff and visitor to our center are thoroughly screened. If a person is suspected to have any infections, they will be ushered to a different entrance. Your safety is important to us. So let's flatten this curve. Stay home, stay safe.
Hello, I'm Dr. Hia Xiaozu. I'm the pediatric dermatologist from Sunway Specialist Center Damansara and Sunway Medical Center. Okay, look for signs which are warning signs, red flags like fever, fast expanding skin lesions, or when the skin lesions covers most of the body, or any signs of rapid progressive skin disorders. And then it's the time that you give a call to the dermatologist to arrange an appointment. We always give a message or even a written email to patients who need to come to the doctor to clear your roadblock. Take care of your skin during this period of time. Stay at home as much as you can. Stay safe and let's flatten the curve.
Hi, Assalamualaikum. I'm Dr. Tunku Putri Zainab, resident consultant pediatrician from Sunway Specialist Center Damansara. Let's say your child has got high-grade fever for 3 days or more, or having vomiting and diarrhea, or having signs of dehydration like not passing urine for at least 8 to 12 hours. crying without tears and not active and appears unwell. Or let's say if your child has got bronchial asthma and appears to have difficulty in breathing. So these are the conditions where you need to bring your child to the clinic. What I can advise is you could actually call your doctor, speak to your pediatrician or your family doctor and see whether you could actually treat the mild symptoms or you urgently need to bring your child to the clinic. There are some precautions that you can take in which you could actually make an appointment to the clinic. This is to avoid long waiting time, and also while you're waiting at the waiting area, you can actually practice social distancing. I hope you enjoyed and benefited from this video. Stay safe, take care, bye.